Safety, it's a platform-based kind of side effects, the cytokine release syndrome and the neurotoxicities. And then depending on the grade and the severity, it's a class effect. Regardless of what CAR T cell you use, you are going to see either or. That's why it is required for the commercial part that initially to be used in specialized centers where there's skilled resources from nursing, from physicians, for intensive care and so forth. But it's manageable. It's scary, especially for the patient family and the patients when they go through these side effects, but then most of the time it's reversible. So I don't know what the label would say for the Novartis. We'll have to wait and see. But it would be very good to have two products. And it's good for patients to have options and for physicians to have options. We'll have to see what's the indication for either or how they will differentiate each other from each other. There's no randomized trial comparing one over the other. Both they seem to have good activities with similar side effect profile. If you have a patient, let's say, with relapsed or refractory large lymphomas, failed at least 2 prior regimens, and you want to refer for CAR T cell, let's say to our center, we work as a group to decide the eligibility, feasibility, practicality. Is this patient a good candidate for a CAR T cell? Is he candidate for autologous transplant if they didn't have autologous transplant? Are there other options? But let's say a decision is made as a group that this patient is candidate for CAR T cells. There is a multi-step process. The first step is to collect their T cells through a process called the pheresis, right? And then depending on the sponsor, let's say if it is a Kite, you have to send it to a certain center. If it's Novartis, you send to another center. And take on average between about 2 to 4 weeks to prepare the CAR T cells and send them back to you. So in the meantime, you may need to use some sort of treatment. It doesn't have to be chemotherapy. It could be small molecule, it could be antibody, it could be a combination of both to hold the disease, preferably shrink it a bit before you give the patient back their CAR T cells. But before you give the CAR T cells, about 5 days or so, you still have to give a different type of chemotherapy, which is called conditioning regimen. Most conditioning regimens are like a mild type of chemotherapy, but mainly what's called lymphodepletion. This is to suppress the patient's own T lymphocytes to allow the injury T cells to come in and work in a better environment.